Views expressed on this program are not necessarily those of Mercer University or WMUB. Hello, everybody, and welcome to yet another edition of the Middle Georgia Spotlight. I'm your host, Jack Ellis. Thanks so much for joining us. The program is made possible by Caduceus Medicine and J. Franklin Automotives. Hello, everybody, and welcome to yet another edition of the Middle Georgia Spotlight. I'm your host, Jack Ellis. Thank you so much for being with us again this week. In the spotlight this week, of course, coronavirus has been in the spotlight for the last 3 months. So most of the shows that we've done over the last 3 months has been about the coronavirus. But now we have, as our guest today, someone who's working in the health education field for Navicent Health, and her name is Kerisia Wasztyl. Did I get that right? Wasztyl?
Nice try. It's Kerisia Wasztyl.
Wasztyl. It's a Polish name, but I've been practicing, but obviously I got it wrong. But the most important thing is the knowledge that she's going to share with us here this week on the Spotlight. Welcome to our program.
Thank you very much.
Well, as I said, we will talk about what you do and as it relates to Corona, but beyond Corona and even pre-Corona, because what I didn't realize is all the work that you are doing at the medical center, well, Navicent Health now, to educate the community about healthy living and healthy lifestyles. And your job title, I see, is the supervisor of Healthy Communities. Tell us a little bit about what that entails.
What a loaded question. There's so much that does
entail.
Well,
you can start wherever you like.
Okay. So as the manager of Healthy Communities, my role is twofold. One, to make sure that that our team is addressing the needs of the patient. And as the community health piece, we're making sure that we're addressing the needs of the community. And a lot of that has to do with the partnerships that we build, assessing the needs that are in the community, and exploring how we can be a part of the solutions for the community. And that is like I mentioned before, our community health piece. And when we come to the care coordination piece of what we do, we work with those patients that are high risk and making sure that, one, we can educate them on their illness, explore their motivation for change, because we recognize that we cannot make anybody change, but we can identify what is your goals, what are your desires. And our backgrounds, for most of us, is in counseling. And so our team members are trained in motivational interviewing, exploring with the patients and their families, because we're not just working with the individual patients, but the entire family system, being able to say, how can we as a healthcare system help you identify the resources, the gaps in care, and connect you to the places that you need to go to get the best possible care. So we're looking at it from working with patients and families and the greater system as a whole for the Middle Georgia community.
Well, let me hasten to add, if you notice, my guest is wearing a mask because she's a health educator, so she wants to make sure that she's putting forth the best example. But let me say that we are 8 feet apart it's measured. I don't have on a mask because we're 8 feet apart, and I understand if the other person is wearing a mask, I can't infect you, and you cannot affect me. But I want the audience to know that we are socially distanced here. But I appreciate you wearing the mask.
Most welcome.
And I'm sure it's part of your job title to wear a mask. Now, how does your job differ from, we had early on in this, during this pandemic, we had someone on from the Northeastern Health District, I think, or whatever district this is here in Macon, as well as the Bibb County Health Department. Or did we have, no, maybe it was the Northeastern Health District. So it was the Health Department. We had two topics. How does your job differ? How do you relate to the health department and their education, or the Northeastern, the state health? How do you all work together? How do you differ?
That's a fantastic question. So when I think about the health department, they are looking at the system as a greater whole. So they're looking at trends, and most of them, from what my understanding, I'm not the expert on the health department, but they have a background in public health. So they're looking at, and one of the great examples is actually one of my fellow teammates who has a background in public health. She talks about when, for example, you encounter a pond and there's a dead fish in the pond, they try to go, well, what's going on with this, within this pond, so that they're seeing this dead fish? Is it something systemic that they need to be able to address and look at? Is it the water? How can we make sure that we're understanding what's going on within this system? And whereas our team, we're, like I mentioned before, we're working closely with families, we're working closely with community partnerships and agencies, but they're looking at it for policy, I'm assuming, policy levels to see how they can affect change, not just for the individual family, but for the greater system as a whole, because they're looking at how is what's happening more of a global situation for them to manage.
And your area consists of what? Where do you work? Bibb, Houston, this primarily the Middle Georgia area, are these two counties?
So when it comes to, remember, like I mentioned before, there's two components. There's the community health piece, and so for a community health piece, most of our work is done within the Macon area. But for the patient population health piece, we try to support the patients that leave the hospital. So, and Navicent serves several local counties and local areas. So we would actually provide support for those patients and those families outside of the Middle Georgia area. So the Baldwin, the Peach, Crawford, anyone that touches the Navicent system that's in the hospital, and we follow them once they leave the hospital.
Well, I noticed that your job title is the Supervisor of Healthy Communities. How healthy is the community as we speak
That
today?
is such a fantastic question to ask, because I think we're continuing to look at that, and we recognize that every system, every agency, every community has the potential to make some changes. And a couple of years ago, we did the Community Health Needs Assessment. It is something that we do every 3 years to see where are we. And we recognize, like I said, that there's work that needs to be done. The Robert Wood Johnson Foundation also does a scorecard to see how healthy is our community. And we did make some improvement from where we were. Do not ask me the exact number, but we demonstrated some success. And that's the great thing about what we're doing. Like I mentioned before, my background is in marriage and family therapy, so we look at what is going on now, what is our goals for the future, and what steps can we put in place. So we do recognize that it could always be healthier, but having the right people on the bus trying to make those changes does make a difference. Partnering with the right people who are excited about making changes in our community can make a difference. Our community is not where we want it to be, but I see that we are invested and members of our community are excited about making changes. So to answer your question, it's not where we want it to be, but it is increasing and it's improving, but we still have some work to do.
Well, speaking of that program that you mentioned, or this assessment, I have a copy of it. I read through it over the last 3 days, 2 days once you agreed to be on the program to make sure that I understood, that I understand some of the challenges that we have, and there are a lot of challenges in here, but thank God at least we know what they are.
Absolutely.
But one thing that stood out to me as I went through this document, especially with the onslaught of this virus, was that the amount of people that were documented, and this was 2015, the last
Right.
one here.
Well,
today.
but the most recent was 2018.
Yeah, 2015. But what I noticed there, this long before we knew anything about Corona, was the amount of respiratory disease deaths in our area that you made mention to here. And it was like, we are number one in the entire area. Bibb 48.8, 48.4 for every 1,000, I guess 1,000 patients. And Houston was 45, and Georgia, Georgia was 45.2, and the U.S. is 42. So that means that we are leading the pack in the wrong direction, if you will, Bibb County. So it shouldn't surprise us then that we see so many people, especially those who've been contracted, that has contracted this disease, are having some, it's compounded, if you will, because we already had a lot of people suffering from respiratory problems. And so, and what will you say, what can you say, or what do you say to this large population with the respiratory problems that's not in necessarily the 65 to 75-year-old group where I fit in, but they are as, compromised, if you will, than as an older person. So how do you communicate to them as to how to maneuver through this virus?
That is a good question. In my mind, I'm thinking about the patients that I have seen personally, the patients that I've worked with that has COPD. And some of those are that question is some of the same things that we pose when we're sitting in their living rooms talking about it. For one particular gentleman, we talked about our toolkits. So we recognize that when we're sharing information regarding health education, it has to be on a level that they can understand. So if reading is an issue, our team will spend time making sure that, one, they understand what their disease is, what the course of treatment might look like. We sit down with them and we come up with questions so they're a part of the shared decision making with their physician. So we go to their doctor's appointments with their physicians and we say, hey doc, I want you to understand that Mr. Joe has had COPD for some time, but he is still struggling to understand what the future will look like for him. I want to make sure that he has this information. So what I would tell those individuals is that they have a right to know what's going on with their health as members of the care team, because they are a member of the team as well. They have a right to ask questions regarding their physicians about what they can expect, what the treatment will look like. So we do some education, but we also explore prevention. We want to make sure that we're looking at those areas that might be high, that might have high incidences of COPD, and how we can put infrastructure, education, technologies in those areas so that we can prevent future people from having chronic complex issues to deal with. So we're doing some education and some prevention. So to answer your question, I would help them to understand that there is hope and that there are systems out there to help them to overcome the challenges and barriers that they might face.
Now, the work, the services that you provide to the community at large, it is free, from what I understand. Mm-hmm. There's no charge, so people don't have to have insurance, but you take this program to the community and try to get people to live a healthier life, the bottom line.
Absolutely.
But what you do is free of charge. This is the outreach that Navicent Health is doing for the population. Right. So we're not just waiting for people to come in and we deal with them, but we are proactive, we're out working with them. Is that what we're doing? Yes,
we're trying to make sure that we can find solutions so that we don't have to have this community continue to have continued decline. So we do work a lot with our faith-based communities as well, providing our toolkits to local churches, providing speakers bureaus. So if, for example, a church or a senior community has questions, they can ask our community to be able, our team to come out and have a nurse or a doctor. If you have questions on COPD, heart failure, then our doctors will come out. Sometimes our residents will go out and provide speaking engagement to these organizations, to these churches, to these senior housing, so that the community, so that the individuals that's living in these communities can have access where they are to the resources. So yes, we do provide health fairs, health screenings, whatever we can as a part of our community health to the people that need it the most.
Now, do you put together programs? Let's say if I was, I'm down at the Senior Citizen Center and you come down and you give us a presentation and we say, well, I would like to have a better program, a better diet, or I'd like to get on a better exercise program. Do you tailor it to individuals or this very general, for the general population?
So far in the past, I can tell you what we've done. We've worked with community agencies. Like I mentioned before, Navicent wants to be a part of the solution. So one of the things that we've done is partnered with Cherie Stevens from You Create Macon, Bike Walk Macon, the Macon Bib Recreation Center to start a Walk with a Dog program, so we can help those seniors who want to be able to walk and have a doctor at the side. So when someone recognizes that, hey, we need this, we bring our team to the table and said, let's as a community solve, because it's not that Navicent has the answer for everybody's problem. We want to be a part of the solution. When we talk about diabetes and how to make changes, we partner with First Primary, with the BIB UGA extension, with Family Connections. It's about getting those partners at the table to say, how can we solve this problem for our community? And it's the community saying, well, what are some of the problems? Because sometimes we will think, we have the solution for you. But as my therapist background says, people have some sense of what might be best for them, so working with them to solve their own problems. So it's about saying, I can recognize that there is a problem in our community. Let's bring the community in. We're doing something similar with United Way and Pleasant Hill. We're not trying to say we have the solution for everybody's problem. Let's go into Pleasant Hill and say, how can we as a team work to solve the problems with the members of Pleasant Hill to make it a community that the residents will continue to be proud of and happy and feeling a self of well-being being there.
So what I'm hearing is that you're a convener because
I've heard that so many times.
Yeah, you're a convener. In other words, you have, well, Navicent Health, let's face it, you're the 800-pound, and I hate to use the word gorilla, but I love gorillas. I represent Uganda, and we have silverback gorillas there, and I encourage people to go and trek. You know, I have
Very
myself,
nice.
but so they are not. When sometimes people use that word as in a negative sense, but gorillas are very gentle and they're big, but people respect them. So you're the 800-pound gorilla, if you will, in the town. So you can provide resources as well as bring people together and then share resources as to.
Well, thank you for that. I appreciate that.
Yeah, that's what That's how
I've heard other people use that example as well to describe the work that we do.
Yeah. But what we have noticed is that, and during this pandemic, is that more people of color, and even in your book, even though in your assessment, I noticed that you don't break things down by race a lot. That when the respiratory problem here, I didn't see how many of these people were African American, how many were.
Well, I know that the current one in 2018, it does have some statistics with African American, I'm not sure if Hispanics, but whites as well. But I know for 2018, I did see some, but I know that one's 2015.
Yeah. So, based on the disparity, what we're hearing on the media, that looking at the numbers that comes out, that African Americans are suffering, especially in the state of Georgia, as well as other states, disproportionately to their percentage makeup of the population. And of course, that's attributed to a lot of cases. And we know that you're not in policy; you don't set policies as to, but you are in the prevention business. What can we do as a community, not just the African American community, but the whole community, to make sure we have a healthier community, especially those who are being devastated by this? Is it diet, exercise, is it information, all of the above?
All of the above. And one of the things that I saw with the COVID situation that's happening to our entire world is the Make and Bib community, United Way, the Community Foundation, they got together and we have weekly calls where we address, I'm trying to remember all of them, childcare, food, housing, shelter, senior, even pets and animals. And the community got together and I was enamored and amazed to see that they were all at the table, and there were many people on the phone calls and saying, how is this affecting you? How can we support you? So the community is actually at the table doing the work. And I actually created, to answer your question, I try to have everything. You said, what can we do? When I think about it, it is those partnerships. And it's making sure that, I imagine that we're trying to build a house, and you need different tools. You've got a hammer, you've got a nail, you've got pencils, rulers. Everybody in the community has a tool, have a skill that they can bring to the table to truly build a healthier community. And so it's about getting the people at the table that can bring their skill set to make this truly better community. When I think about change in healthy systems, I love nature. And one of the things that come to my mind is the bee colony, where there is defined roles. There is the queen bee who has her role. There's the ponds that have theirs. Everybody has a role to make sure the entire system is functioning well. And when I think about our community, it's how can we come together to make sure that we're all functioning well? Because if one of us is not doing well, the entire community is not doing well. Being able to identify where are the gaps in care and making sure that we can do something to address those gaps in care. And there's lots of assessments being done to see, are there different areas in Macon that could use a little bit more support? One of my directors, she's working with the Bibb County GIS system to be able to identify where can different technologies be put in so people can have access to the Wi-Fi system to be able to get access to the cares that they need. Education, again, is a big piece of what we have to do. Some of the patients that I've seen in the past, they didn't even for mental health. When you're diagnosed with a disorder, say bipolar, and you're being given medication, you don't know what it is, then it's not getting the full impact of what it can. So being able to educate our community on the tools that we have, the resources, and what's actually here, because sometimes you'll find something out and you're like, I didn't know that was in Macon. It's a best kept secret. I don't want anything in Macon to be a best kept secret. I want people to be able to know where the resources are, know where the tools are, and know how to utilize them, because it impacts all of us. If there is a child out there who has the potential to one day cure cancer, but he doesn't have enough food on his table, that can impact my children's children one day. So I want to make sure that every single child has the potential to be who they could be. So that's through education. And again, sometimes recognizing that our faith-based community has a lot of resources that we can turn to is another one. So there's, like you said, there's just a plethora of resources that can truly be put in place to make our community healthier.
So you are dealing with all age groups, teens, preteens, adolescent, not adolescent as a teen, but from the cradle to the grave, if you will.
Right. So when we do, a lot of our work focuses on the adult world, but that's one of the things that I've actually reached out to my nurse researcher, Mary Hoey, and I said, hey, I want to do a lot more when it comes to the pediatric. One of the things that Mary and her team was working on is this thing called SCENT. It's a dog that has an acronym that says NOSE, that can teach young people about diabetes, because there's lots of children that have diabetes, and it's kind of scary because you want to be normal like everybody else. You want to be typical, and so being able to help them understand and help their peers understand what it is takes some of that stigma away. So yes, we're looking at the adults, we're looking at seniors, and we're trying to have a bigger impact in the children's world as well.
While I asked that question, in this assessment, I noticed that teen pregnancy is very high in Bibb County compared to the surrounding counties, state and nationally. Are you working in that area at all?
Not yet.
Not yet. Okay. But we hope you'll get there. The other thing that affects our community more so than any other community, gun violence. A few years back, during my term as mayor, I remember the CDC, I went to a meeting and the CDC proclaimed that gun violence and homicides among teenagers and young people is not a criminal problem, a criminal justice problem, but it was a public health problem. Do you subscribe to that?
When you were speaking, again, for me, it's looking at the partnerships that we have in the community. One of the partners that I work with closely is the school justice system partnerships. And so again, it's recognizing that there is violence. Even when we did the on-the-table discussion, violence came up once again as an issue that the community identified.
As a health problem. It came up as a health problem? It
came up more of a societal problem in general. I don't think it was necessarily seen as a health problem.
But you're aware that the CDC a few years back did proclaim gun violence, especially in urban areas and like Chicago and even here. We've had 42 deaths a couple years ago with gun violence. Hopefully we won't have that many from corona, from other things that's affecting young people. So it stands to reason to say that it probably is a health problem, a mental health problem, or some type of problem. But we won't put you in.
Well, actually, I like what you said earlier, that you're a student, and I adhere to that same principle. So when I hear something, I go take it back and I process it and see how I can learn a little bit more. And so even though I am not an expert on that, I will take back from this conversation to take another look at that when I go back to my office. Cause
I was wondering if the CDC still classifies homicides, especially in urban centers, as a health problem rather than a criminal justice problem.
I'm going to take a look. I'm going to take a look.
Okay. Well, there's so much you're doing. You know, I share with the audience here, I had an opportunity to meet with her team last week prior to inviting them to come, and I was astonished as to how much you are doing in this community, because sometimes, like you said, we're making incremental progress and dealing with these diseases and getting people healthy. because if you just take a 30,000-foot view, maybe from my vantage point, sometimes it looks like we're not doing too much, even though we have some of the best hospitals, and Navicent at the top of that heap.
Thank you.
And we have some of the best doctors. We have a very good medical school, and we have these great programs. But it still seems to me that we are not making the progress that we should. And I know we all have a responsibility, and we're working on it on a daily basis. Is that a fair assessment?
Mm-hmm.
That
It is. I think what I heard you say from that is that we have some expertise in our community. We have some work to be done. And that sometimes looking from the outside, you don't see what's actually the full impact of what's being done. And so sharing what everyone is doing, bringing that information to the table, we can actually have a bigger view, a grander view of what the work is truly happening in our community.
Well, you know, they always say you can't fix what you can't measure. That's what I was taught. So how are you, when you say we're making incremental progress, how do you judge that? How do you gauge that on a yearly basis? You look at a particular metrics?
Yeah.
How do you?
So one of our doctors, Dr. Reg Gilbert, he has a system. I hear him talk about it all the time, the GIS system. But as a hospital, we do take a look at those trends. Dr. Gilbert was the one. I know what he shares with us on a smaller level, but I know that as a hospital, we are taking a look at the impacts that we're having. So when you were talking about the COPD. We have different programs that we use to try to address COPD. And so we want to take a look. Is this having any impact when we're talking about reducing disparities? And through that, he wants to say, we're going to invest money into a program that's going to address COPD. We need to make sure that there's a benefit to it. So he does the programming to take a look, and also CMS, they kind of tell us how we're doing. So there's different ways for us to measure what's happening. But that would be up to the higher level hospital administration that has more information to do with the outcomes, so to speak.
Now, you mentioned the faith community, which is a very important sector, but they are out right now. I guess they're not practicing social distance, so they're not in. But how do you reach, let's say, outside of the faith community and the public school system? You say you work with children, but not necessarily, they're not your main group that you're focusing on. But do you work with the school system?
I do. Navicent also has school nursing staff within the school system, and so that's one of the things when this COVID situation came about. We looked at how do we engage? Were the students being able to have proper nutrition over this, over the time when they were not in the school? And I was able to reach out to a few individuals in the community that talked about how they were able to use the bus system to continue. It's called the school backpack program. So they're able to still provide food to the school system. Work closely with forgot her name, Jill Vanderhout with Family Connections, Fighting Partnerships, to be able to make sure that one of our teammates are actually at their meeting so we can address the needs of the students and the younger population. Like I said, it's not our main focus, but we still try to make sure that we are touching and having a voice at the table and lending our talents and our support to where we can to address the needs that the youth have.
What I'm glad about is that this hospital, this healthcare system, especially Navicent Health, even though they're in the business of providing service for people who are sick and in the business of making money and so forth, not making money, but it's part of it. But what I hear you saying, which is very good music to my ears, is that you're in the prevention business. So we want to prevent people from having to go into the hospital in the first place, other than to get their checkup and things of that nature. Is that a fair assessment?
Our hospital wants to make sure that if you require the care, that you know where to go and get it, because we want to provide the best possible care for you. But we also want to make sure if we can do anything to prevent you and your generations from having adverse life effects regarding your health, we want to make sure we can do something to prevent that as well. Because one of the things that I thought to myself is, if there is only one bed available in the hospital, and we could have done something to prevent someone who could have had earlier prevention. That one bed could go to someone who needs it into a greater capacity. We want to make sure that the person that we're helping, and we want to help as many people as we can, but we need to think about the location of where the help happens best for them.
Is this the successor, if you will, to the old Partners in Health? Have you heard of the medical center years ago had a program called Partners in Health? I guess you don't have that anymore. The Partners
Tell me a little
in Health.
bit more about that.
Well, it was an organization, I guess, some of your Partners in Health, that they had health educators, they would go around the community. So I guess this is
Charles did mention that
to-
there was something back before my time, but he did mention there was something similar.
Yeah.
I think at the old mall, they used to do a lot of work
I
out
don't
there
know,
as well.
I remember the term Partners in Health.
Okay.
That they, and I guess they work together to do what you're doing. So
Okay.
that
Probably a little bit
I-
before my time.
I would sort of, yeah. Now, because we are in a pandemic, and because the what do you call it? So many things that people don't know, so much misinformation. How can people? Can you act as a clearinghouse for information? If so, how do they contact you? If someone wants to know more about what you do, how do they contact you?
So our Healthy Communities page has a great deal of information, and we try to make sure that we provide good, accurate information, valid information. We get it from the CDC, we get it from the health department. It's in our toolkits, but we make sure that's on our Healthy Communities webpage. So if anyone has any questions, they can go to our website and we connect them to the accurate, valid information. We do not want Dr. Google being the one to give you information regarding your health.
Well, I've been told that our time is up, but so much information to share, and I wish we have to come back some other time. But we've been talking with Kerisia Wasztyl, and she is the supervisor of Healthy Communities for Navicent Health here in Macon-Bibb County, doing a great job. Get in touch with her, that she's willing to come out and speak to your group, share information, give you some professional advice as to how you can live longer and live healthier. In the meantime, wash your hands, social distance, wear a mask, and be blessed. Until next week, I'm your host, Jack Ellis. Goodbye.